Welcome, this is Orthoflix. Anything you need to know about orthopedics and trauma, you are at the right side. You need to know anything about orthopedics and trauma, I got you covered. So last time we were looking at types of implants. There are many and we will continue looking at them. Remember, anything you need to know about orthopedics and trauma, I got you covered. So stay tuned as we go through them. Thank you.
Even when you feel low, you can still go. Even when you feel slow, you can still go. Even when there's no hope, you can still go. I never answer to no, man, I still go. Go, 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 yo, go, go, go. Hustle hard, hustle every single day. I'll be making moves till I'm buried in my grave. To the system, I don't wanna be a slave. I've been doing shit my way, or the highway. And in the driveway is a nice range, cause I grind through the climb, I invite pain. You'll never hear me, bitch, nah, I don't complain. Just gotta flip the switch and you can go and obtain anything you want, anything you need. Your mind's got the key ingredient, it's belief. They deceive with the negativity, but I just slide right.
So on our countdown, number 1 we have the Smith-Patterson nail, abbreviated as SP. So there's also Smith-Patterson nail with an MC Lowland split. So it's indicated for fracture of neck or femur. So this Smith-Patterson nail, it's a 3-flanged stainless steel nail used in orthopedic surgeries to anchor the neck of femur to its head in repair of an introchanteric fracture. It is introduced below the preeminence of the greater trochanter and passed through the fractured part, so into the head of femur. So the nail is hammered into the outer side of the bone so that it passes through the neck with the tip lying in the spherical head as shown in the image above. The Seidel nail. The Seidel nail makes our implant number 2 or prosthesis number 2. So it's indicated for fracture shaft of humerus. It is also indicated for cases involving failure of previous treatment, involving pathological fractures or multiple injuries, or support a damaged bone. It's fabricated using stainless steel and titanium alloys for strength, and the plastic coating that is done on it acts as an artificial cartilage. The Sotas Strathclyde prosthesis or implant, indicated for elbow replacement or elbow arthroplasty, especially in conditions such as rheumatoid arthritis. So it has shown a satisfactory result in many patients. Pain relief has been achieved in many cases, so the mean range of flexion is increased from 24 degrees and extension improved 8 degrees, with the upper limb flexion greatly improved with a low rate of complication and minimal cases of prosthetic loosening. Stiff plate is our prosthesis number 4. So it's indicated for fixation of the spine. So the plates have a long slot which can be fixed over the screws and have nets in which the special pedicle screws get locked and prevent the plate from moving. It can be used from lower thoracic spine to the sacrum. So pedicle screws fixation has enabled surgeons to instrument one above and one below, thus decreasing the exposure, preventing movement segment, avoiding long fusions, and providing a stable construct. Our number 5 splint, we have the Steinman's pin. So it's indicated for skeletal traction. It's a pin used to transfix bone for traction or fixation. It is passed through the distal end of the femur or the proximal end of the tibia and held under tension in a steel stirrup splint, so that traction can be applied in the treatment of a fracture. So a sterilized drill chunk can be fitted to a surgical power drill and fitted with the pin and drilled through the bone. So number 6 we have the Swanson's prosthesis. It's indicated for replacement of joints of the finger. So it's prescribed as a solution for hands disabled by osteoarthritis or post-traumatic arthritis or even fractures. So the Swanson finger joint implant has proven to effective treatment of small joints arthroplasty. It is the ideal instrumentation for hands that are negatively affected by the post-traumatic arthritis and osteoarthritis, with 40 years of clinical use in orthopedic surgeries. So our last implant is the Talwaka nail. is indicated for radioulnar fractures. It has shown improvement in union compared to using plates. So there are also stress sharing, which facilitates secondary periosteal callus formation. So whatever has an advantage also has a disadvantage. So it has shown a minimal complication like implant infection or cranial bursitis or even radioulnar synostosis. Thanks for watching. You are at the right site. In case you need to know anything about orthopedics and trauma, don't forget to click and subscribe. So next time I will be talking about osteoarthritis. There are 4 stages of osteoarthritis we will be looking at. Thank you. Let's meet next time. Don't forget to subscribe and click the bell.